Join me as I dive deep into understanding what's really going on in the body with Sjögren disease and cystic fibrosis. Can I unravel the mysteries behind these conditions? Sjögren's disease and cystic fibrosis, two conditions that affect the body in significant ways, leading to serious health challenges that can be overwhelming for those affected. Both of these diseases can cause widespread damage, disrupting the normal functioning of various bodily systems. But despite their differences, they share a common thread: both are autoimmune disorders that target specific tissues and organs. As we explore the impact of these diseases, it's essential to understand that they're not just about the symptoms you can see, they're about the underlying mechanisms that drive them. It's about how the immune system goes awry, causing inflammation and destruction that can have far-reaching consequences. The more we learn about Sjögren's disease and cystic fibrosis, the more we realize how complex and multifaceted they are. From dry eyes and mouth to respiratory failure, these diseases can manifest in various ways, making diagnosis and treatment all the more challenging. Living with Sjögren's disease or cystic fibrosis can be a daily struggle, marked by fatigue, pain, and uncertainty. Simple tasks become daunting challenges, and the emotional toll can be devastating. It's not just about managing symptoms. It's about finding ways to cope with the emotional and psychological burden of living with a chronic illness. For those with Sjögren's disease, the constant dryness and pain in the eyes, mouth, and joints can be debilitating. The loss of saliva and tears can lead to cavities, gum disease, and blurred vision, making everyday activities like eating and reading a struggle. Imagine waking up every morning with a mouth that feels like the Sahara Desert, or having to deal with recurring sinus infections that leave you feeling exhausted and defeated. This is the reality for many people living with Sjögren's disease. Cystic fibrosis, on the other hand, primarily affects the respiratory and digestive systems. Thick, sticky mucus clogs the lungs and digestive tract, making it difficult to breathe and digest food. The constant coughing, wheezing, and shortness of breath can be exhausting, leaving individuals feeling drained and isolated. The daily routine of medications, nebulizers, and physiotherapy can be overwhelming, taking a toll on mental health and relationships. The fear of respiratory failure and the constant need for hospitalization can create a sense of uncertainty and anxiety. Diagnosis for both conditions can be a long and arduous process, often involving a battery of tests and scans. Misdiagnosis or delayed diagnosis can lead to further complications, making it essential to raise awareness about these conditions. Both Sjögren's disease and cystic fibrosis have a significant impact on daily life, affecting relationships, work, and overall well-being. The constant need for medical attention, the fear of complications, and the emotional toll of living with a chronic illness can be overwhelming. Let's dive deeper into the mechanisms of these diseases, exploring how they affect the body on a cellular level. Sjögren's disease is characterized by the immune system's attack on the exocrine glands, responsible for producing tears, saliva, and other bodily fluids. This leads to inflammation and destruction of the glands, causing dryness, pain, and dysfunction. The immune system's overactive response also triggers the production of antibodies, which can further exacerbate the condition. In cystic fibrosis, the defective CFTR gene disrupts the transport of salt and water in and out of cells, leading to the production of thick, sticky mucus. This mucus clogs the lungs, digestive tract, and other organs, causing respiratory failure, malnutrition, and a host of other complications. The disease affects multiple systems, including the respiratory, digestive, and reproductive systems, making it a complex and multi-system disorder. The buildup of mucus in the lungs can lead to chronic infections, further exacerbating the condition. Research has shown that both Sjögren's disease and cystic fibrosis have a strong genetic component, with certain genetic mutations increasing the risk of developing these conditions. Environmental triggers, such as pollution, tobacco smoke, and other toxins, can also contribute to the development of these diseases. Studying the mechanisms of these diseases has led researchers to explore new treatment options, including gene therapy and stem cell therapy. These innovative approaches offer hope for managing these diseases more effectively, improving the quality of life for those affected. One groundbreaking study has shown promise in using gene editing technology to correct the defective CFTR gene in cystic fibrosis patients. This treatment has the potential to reduce the severity of symptoms, improving lung function and overall health. Another area of research focuses on the role of the gut microbiome in Sjögren's disease. Researchers have found that an imbalance of gut bacteria can contribute to the development of the condition, and that restoring the balance can lead to improved symptoms and quality of life. These breakthroughs offer new hope for individuals living with Sjögren's disease and cystic fibrosis, providing a glimmer of light in the darkness of these debilitating conditions. In conclusion, Sjögren's disease and cystic fibrosis are complex, multifaceted conditions that affect the body in significant ways. Understanding the mechanisms of these diseases is crucial in developing effective treatment options and improving the quality of life for those affected. Remember, living with a chronic illness is not just about managing symptoms. It's about finding ways to cope with the emotional and psychological burden. It's about raising awareness, promoting research, and advocating for those who need our support. If you or someone you know is living with Sjögren's disease or cystic fibrosis, share your experiences in the comments below. Let's create a community of support and understanding. Thanks for watching. So if you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.